Shark fin cartilage has been used for cancer, arthritis, and psoriasis. It is not recommended for use in children. Some herbal/diet supplement products containing shark fin cartilage have been found to contain possibly harmful impurities/additives. It is important to consult your doctor for proper treatment and to check with your pharmacist for more details about the brand you use. The FDA has not reviewed this product for safety or effectiveness. When taking shark fin cartilage, it is important to follow the directions on the product package. If you have any questions, consult your doctor or pharmacist. If you are using the powdered or liquid form and mixing it with juice, make sure to mix it right before use and do not prepare it in advance. If your condition persists or worsens, or if you suspect a serious medical issue, seek medical assistance immediately. Some common side effects of taking shark fin cartilage may include nausea, vomiting, upset stomach, changes in taste, and constipation. If any of these effects persist or worsen, it's important to contact your doctor or pharmacist. Serious side effects that require immediate medical attention can include signs of liver disease, weakness, unusual tiredness, dizziness, increased thirst and urination, shakiness, and mental or mood changes. It's important to seek medical help if you experience symptoms of a serious allergic reaction, such as rash, swelling, severe dizziness, or trouble breathing. It's important to note that this is not a complete list of possible side effects, and if you experience any other effects, it's important to contact your doctor or pharmacist. If you are in the US, you can call your doctor for medical advice about side effects, or report them to the FDA. In Canada, you can call your doctor for medical advice about side effects, or report them to Health Canada. Before taking shark cartilage, make sure to inform your doctor or pharmacist about any allergies you may have. This product may contain inactive ingredients that can cause allergic reactions or other problems. Also, let your doctor or pharmacist know about your medical history, especially if you have high levels of calcium in the blood, diabetes, heart or blood vessel disease, kidney disease, liver disease, or if you have recently had surgery or an injury. If you are using the liquid form of this product, be aware that it may contain sugar and/or alcohol, so it's important to talk to your doctor or pharmacist if you have diabetes, alcohol dependence, or liver disease. It's also important to note that this product is not recommended for use during pregnancy, and if you are breastfeeding, consult your doctor before using it. It's important to be aware of potential drug interactions with shark fin cartilage. Certain antibiotics and products containing calcium may interact with this product. Always consult with your doctor or pharmacist before making any changes to your medication. Keep a list of all the products you use, including prescription and non-prescription drugs, and share it with your healthcare providers. This will help ensure the safe and effective use of shark fin cartilage. If someone has taken too much shark fin cartilage and is experiencing severe symptoms such as fainting or difficulty breathing, it is important to seek immediate medical help. In the US, you can call your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center for assistance. During the use of shark fin cartilage, it is important to stay updated with your medical tests to monitor calcium levels and blood glucose levels. It is recommended to consult your doctor for more information and to keep all medical and lab appointments. If you forget to take a dose of shark fin cartilage, take it as soon as you remember. If it is close to the time of your next dose, just skip the missed one. Take your next dose at the regular time. Do not take a double dose to make up for the missed one. Make sure to check the storage information printed on the package and ask your pharmacist if you have any questions. Always keep medications and herbal products out of reach of children and pets. Do not dispose of medications by flushing them down the toilet or pouring them into a drain unless instructed to do so. Instead, properly discard the product when it is expired or no longer needed. You can consult your pharmacist or local waste disposal company for proper disposal methods. Remember to always follow the specific instructions for disposal to ensure safety and environmental protection. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.